Despite the fact that we have several new therapies, and now we have the choice, which was just impossible to conceive some years ago. Um, the point is that um, there is still an unmet need in patients who are treated after the symptoms, and there were several posters about that, like for instance how the scoliosis uh, continue to evaluate in patients who are treated. um, Also, and I've discussed this earlier, how the bulbar function can still be altered at 18 months of treatment, or how the respiratory function remains impaired in this patient. So it remains with an unmet need, and this unmet need that will remain forever in post-symptomatic patients underline the need to get early access to treatment and so to be screened at birth. Um, the the other aspect of SMA treatment, which was not actually really discussed during this WMS, is that um, some patients today have received three treatments, and they are patients who have received nusinersen, gene therapy, and risdiplam. But in the entire world, there are plenty of patients who have not received any of these medications and who will probably never receive it. This was unfortunately not discussed today during this WMS, despite the fact actually that this year WMS could um, welcome 3,000 delegates from countries who usually are not cannot afford to come to the Congress. Nevertheless, we had no data from countries in which today the treatments are not available. Um, we had some data from Chile, but in Chile, nusinersen is available, and most of data were coming from countries where one, two, or three drugs are available. But it was obviously not a topic of this year to discuss the uh, um, unmet need in terms of large treatment access for patients across the world. Probably a topic for next year.